So there are some risks and complications to a shoulder dislocation and a surgery to repair that. Most common surgery complications, as with any surgery, would be infection and problems related to the post-op recovery, such as blood clots and things like that. When you're operating around a joint, there's blood vessels, there's nerves, and other structures that can get damaged, and that's always a concern. But usually the most common complication after labral surgery is you're taking a shoulder that's dislocated, that may be loose to begin with, and you're going to tighten that shoulder to keep the ball in the socket. And the most common complication is loss of range of motion after a labral repair or some degree of stiffness. Sometimes it doesn't matter. You take a linebacker who dislocates their shoulder, you repair their labrum, and you're going to keep that ball in the socket. They've lost some range of motion, but for a linebacker that may not be that big a deal. They don't need to operate with their arm up above their head much. They need to keep their arm out in front of them to make a tackle. But if you take, say, a volleyball kid or a tennis player, and they have shoulder instability, and you repair their labrum, and they're stiff, that directly affects their ability to serve a volleyball or serve a tennis ball, or, for instance, like a pitcher who needs all the range of motion they can get to generate force when they throw the ball. Any kind of loss of range of motion after labral surgery is going to be detrimental. And that's probably the most common thing we deal with in athletes, I think, is stiffness after a labral repair.